someone must have asked me this question one too many times. And I got home that day and I just sat down for like 2 hours and I wrote this thing about like, I'm really tired of people asking me this. And I didn't really do anything with it. And then I finished residency and I found it again. And I was like, I'm just going to try and get this published and see what happens. And to my surprise, it was accepted.
Hey everyone, welcome to HUMED. This is Dr. David Spiro. This is another episode. I'm incredibly delighted and honored to have Emma Cooke with us. She attended Emory College and in Atlanta, not too far from Little Rock where I am, and also got her master's in bioethics there. She then did her residency in a combination of internal medicine and pediatrics at Baylor University, and at a very interesting time during the COVID epidemic, and then became a hospitalist, mostly for adults who were not big children, but she's working with adults at Cambridge Health Alliance, which is sort of the Harvard healthcare system, and wrote an article in JAMA that really moved me, which is part of the reason why we're here today. And Emma, welcome to HUMED.
Thank you for having me.
Yeah, I'm really honored to have you here. So I would love to turn it over to you and to share your story in terms of what inspired you to write that article, and what was that article about?
Yeah, so the article, so it's called When I Grow Up. And what it's about is my experiences being asked by various attendings throughout my medical training about what are you going to be when you grow up? I mean, not just me specifically. Obviously, this is a question that they asked everybody around me. And I don't even remember what the stimulus was for this, but one day I think someone must have asked me this question one too many times. And I got home that day and I just sat down for like 2 hours and I wrote this thing about like, I'm really tired of people asking me this. And I didn't really do anything with it. And then I finished residency and I found it again. And I was like, I'm just going to try and get this published and see what happens. And to my surprise, it was accepted, which was pretty cool. But so I guess talking about kind of what I wrote about, I mean, I think there were kind of two things that I was sort of reacting to. And one was, the question itself, sort of like people will ask you in various ways. They'll say, what do you want to be when you grow up? Or just like they'll ask you in a different way. They'll say, what do you want to do when you finish your training? And the formulation of when you grow up, I always found annoying because I was like, I'm like 32 years old. Like, what are you talking? Obviously, like a lot of your friends at that point are, married, have children, have mortgages, and like some of my friends that didn't go to med school have like, fairly far up the hierarchy, like managerial roles. And then it's like, so I'm still this sort of perpetual student trainee type of person, which is like, I mean, obviously when you decide to go into medicine, you're well aware that that's what you're signing up for. And on some level, I was okay with it, but I did find it a little bit, depressing because it's like, we are, at the time that this was happening, this is no longer true, but at Baylor, when I was an intern, we would be we would be responsible for about 100 patients overnight on the hospital wards. And there was a senior resident who was on a 24-hour shift and who was like asleep. And so you'd be there, all night trying to keep these 100 plus people alive during like peak COVID. And so it felt kind of like, oh man, like I wish you would at least acknowledge that I'm an adult human. So that was like one thing. But then the other thing was kind of not so much about the formulation of the question, which, I understood was actually meant just in a nice way to be like, well, what are you interested in? Tell me about yourself. But the other thing that I was reacting to was that I think we put people in boxes based on the way that they answer. And I saw that it's like, if you ask somebody, what do you want to do? And they say, I want to be an orthopedic surgeon, or I want to be a psychiatrist, or I want to be a pediatrician. Immediately you start making all these assumptions about who this person is. And I saw this when I was on the receiving end of that. Um, because I had, when at that time I wanted to be a surgeon, and people would be like, "You seem too nice to be a surgeon. I don't know if I believe
Hmm.
that or whatever." And I'd be like, "Well, I don't know what to tell you." But then on the other hand, when I became like a senior resident and now as an attending, I see, the trainees will tell me what they're going into. And, even with my best efforts to not do this, I'll be like, "Oh, he wants to be a neurosurgeon. That must mean that he is, X, Y, and Z like characteristics." And I don't want to make those assumptions, but they're so baked into kind of the culture of medicine that it's hard not to. So yeah, I mean, these were the things that I was thinking about when I wrote this. And there's still things that I think about a lot now.
So how has it affected you, as you also mentioned in your article about how it affects you now that you're an attending? You're actually working with students and learners. So how is your approach? I assume you don't ask anyone the question, "What do you want to
Yeah.
do when you grow up?" And you're treating you're mindful of treating the students who are oftentimes in their late 20s, sometimes even early 30s, in medical school, let alone residents in their early 30s, with respect and treating them as adults. So how do you approach these people who you have somewhat limited interactions with? You had mentioned in your essay you usually have 2 or 3 week blocks with them. Um, so how has it changed your approach as a teacher now?
I mean, it's still something that I'm kind of trying to figure out, but one of the things that I don't ask them, like you said, I don't ask them what they're going into. I mean, sometimes they're gonna tell me anyway, and I'm not gonna be like, "Don't tell me, you're not allowed to tell me," but
Mhm.
I don't ask. Um, and one of the trainees who I recently worked with, who was excellent, he asked me for a letter. And when I was meeting with him to,
A letter of
discuss,
recommendation.
yeah, to
Mhm.
discuss what was going to go in
Mhm.
the letter, that was the first time that I found out what he was going into.
Mhm.
So,
Mhm.
and I was actually glad about that, because it's kind of like, well, I don't actually need to know this information to be able to write a letter of recommendation. I mean, he was not going into internal medicine, but it didn't matter. He did a good job on an internal medicine rotation. So, it doesn't, it's information that we think we need, but we don't actually need to make an assessment of somebody, at least in my opinion. Um, in terms of like how do I interact with, residents, students, whoever, I try to just talk about like, you know, what they're up to in their lives. And I think that can be challenging too, because like sometimes, everybody has different amounts that they feel like they want to share. And when I was a resident, I was like super grumpy as a resident. And sometimes people would be like, "Oh, how was your weekend?" And I would think to myself, like, "I was working all weekend. Like, don't ask me." Like, I mean, I wouldn't say that. I'd be like, "Ha, it was great." Huh. But like, I, I think that if I'm going to ask people questions, I'd rather ask them questions that I would ask like any human being, rather than questions that are like specific to like, "Oh, what are you going into?" And questions that feel like I'm kind of sizing them up. Because I do think that, especially in medicine, everything can feel like it has a competitive undertone or a judgmental
Mhm.
undertone, even if it doesn't. Um, and I think it's better to just stay away from topics that can make people feel kind of judged, or, something like that.
Yeah, because you're actually taking me. It's been 3 decades for me. I'm an old dude, but it's been a while. But and I went to medical school at a pretty competitive place called UCSF in San Francisco, and people um, want to do. There are various subspecialties that have various challenges of getting into those subspecialties, let alone to the place that you want to train. So, if I finish my residency and I want to go at medical school, then I want to go into pediatrics and I want to go to Boston Children's, which is part of the Harvard system, not so easy. And, you have to potentially, you have to get good letters and you have to get good grades. And part of, I assume, your role is you're doing assessments on students. And we all have our various biases. I mean, we're human beings, which is part of the reason why we have this show. And we have conscious and unconscious biases. And whether we like it or not, we may be biased about the person's gender or the person's race, or in this case, what the person is actually wanting to choose as their specialty. You right now are taking care of adults. You're an internal medicine physician and you're working as a hospitalist. And you have, if someone says when they're a medical student, well, I want to be in internal medicine, there are some attendings that may gravitate towards them because, oh, wow, I'm going to be training a future person that would be like me. Whereas if you as an internal medicine physician are training a potential neurosurgeon, is like, well, they don't really need to learn this. And so how does that go into the calculus of all this in terms of unconscious or conscious bias?
Yeah, I mean, I think you really just sort of hit on a lot of the really major issues that I think come up on pretty much every time I'm on a teaching service, which is like, if you have a student that is going into, internal medicine, or I guess this applies to whatever specialty you're in, like the same specialty as you, um, I think there can be a tendency both to sort of feel kinship with them, but also maybe to judge them a little bit more harshly, to be like, well, I would expect you to know this more because this is what you're going into. Um, Whereas if the person is going into something unrelated, you might feel like, well, I'm just impressed that you know anything at all.
Mm.
Um, I mean, I think in internal medicine, that's probably less true because internal medicine, so much of it is like the stuff that you learn in med school anyway. Um, but I remember we spent like a week on ophthalmology in med school. We had like a 1 month thing where we would do like a week of ophtho, a week of derm and stuff. And the ophthalmologist at one point like had me do like a retinal exam with the ophthalmoscope on somebody, and he was like, "Wow, I'm impressed that you like knew how to like hold the ophthalmoscope and like you used the correct eye to look in it." And I was like, I was super happy because when you're in med school, whenever anyone praises you, you're super happy. But like, I was also like, wow, your standards are not very high here, because I think, when you're in ophtho, unless people that want to do ophtho obviously are really good at it. And then everybody else is like, doesn't really know anything about it. Um, so, it's sort of like we adjust our standards a lot based on the people that we are, you know, seeing and whether they're going into the same thing that we do. Um, and, I wrote about this, and I think this is the whole can of worms that you open, is that you don't know. I mean, there's been a lot of, discussion, I think, importantly about unconscious bias, like you said, and a lot of our unconscious biases, it's hard to correct for them. It's if you have a bias centering around gender or ethnicity, race, etc. um you can't really, there's no way to not know the way that somebody looks or the way that somebody presents. But there is a way to not know what specialty that someone's going into, because you just can just not find out. So it's like, okay, this is one type of bias that I can mitigate just by not getting access to this information.
Yeah, it's interesting. Have you ever felt, you talked about what kind of some form of bias in your essay around, let's call it my chosen specialty bias, but have you ever experienced other kinds of biases in your training?
Oh yeah. I mean, I think um in some sense I've had it easier than a lot of people because I'm white. But the biggest one that I experienced was definitely being female, and I would say that where I trained, there were certain elements that were quite sexist. This is not to say that everybody there was. There were some of my attendings were amazing and really, really great. But I remember that my intern year, I think it was going into my second year, every year they would have a ceremony to congratulate the people that were graduating. And they gave out like an award, or they gave out like a series of awards for people graduating. And I think there were probably like 15 to 20 awards that were given out. And some of them were kind of like awards that were you had to be nominated for. And then a few of them were awards that like all you had to do was like, oh, if you do X hours of community service, you get this award. And the awards that were like had criteria that were concrete and objective, like, oh, the X amount of community service or X amount of teaching, both men and women got. But every single award that was, selected, that people had to be nominated for, was given to a guy. Not one single award was given to a woman. And
Hmm.
I remember we then a few weeks later had some kind of like Wednesday school, or like the teaching thing that you do periodically.
Mhm.
And they were saying to us, they were like, well, it's so good that programs like this one and so forth have done so much to mitigate bias in medical training. And I remember raising my hand and being like, did nobody else notice that all of these awards went to men? And there was just like 20 seconds of silence. But then later,
Wow.
some of the younger trainees came up to me and were like, thank you for saying that. And, because I thought like a lot of the time, it's easy to just not even notice. And it just becomes part of the background that, you know, I'm here and I'm doing this work, but I'm not going to be recognized for it. That's happening to other people. Um,
That's
and
shocking. That's shocking to me because this was happening in the last 10 years. And
yeah,
you'd feel like in the last 10 years, we've made such a tremendous difference. We had a guest on the show, Dr. David Shapiro, who is outwardly gay. He's talked about it, and it was actually the topic of one of our conversations. And he talked about in the early 2000s interviewing for a surgical residency and witnessing overt sexism and racism and anti-gay experiences during the interview process. By and in the surgical world, you also have had this very interesting experience where you went to medical school in the South and then you decided to train in the South, and now you're working in the Northeast corridor. Do you feel like there are regional differences in the approach of bias towards women in the South versus the Northeast?
it's a good question. It's hard to say because where I work now is also culturally very different in the sense that it's much smaller. It's like a community program. It's not like a huge university hospital. I will say I love where I work now, and I've never experienced any type of like sexism since I've started working there. At least not from my colleagues. I mean, from patients, sometimes, yeah, you're always going to experience that. But like
Like a
from my
patient will
colleague,
say, "Are you a nurse?"
oh
or
yeah, or the
something.
oh hey baby, like that kind of thing. But like
Really?
oh yeah, yeah. Um, I mean, sometimes if it's like a 95-year-old man, like I'm not even going to say anything because I'm like,
Mm.
you're 95. I'm just going to let it go, But
Mhm, mhm.
and then for other people, you're like, okay, you're not going to talk to me like that. And that's just sort of part of the like background noise of just being female in medicine, and you just kind of get used to it. But
Wait, I want to get into that. So if you have a patient that's in their 60s or 50s, or some patient that is rude and actually says something that's sexist, do you feel comfortable as a physician saying something to them?
I'll usually kind of joke about it. I'll be like, do you
Mm-hmm.
know how many years I went to school? Can you not call me baby? And usually they'll like laugh about it and they'll be like,
Mm-hmm.
sorry.
Mm-hmm.
Like
Mm-hmm.
I I really have not had a lot of problems with like calling people out. I think if you just a lot of the time this is the way that people move through the world and the way that they talk. And I try not to assume bad intent because I think sometimes people really don't mean anything bad by it. But and I don't think I've ever had a bad experience being like, don't call me that in whatever way I've said it. I have had bad experiences, obviously, with people just being aggressive and rude and angry. But I don't think that was necessarily based on my gender. I've just had patients who were, being a little wild, and then you have to just kind of address that in the way that you would. I mean, I don't think my way of dealing with somebody who's being inappropriate is different from the way that a guy necessarily would, where I'm just like, all right, well, I'm going to come back when you're ready to be an adult. Um, you know, and I think anybody that works in the inpatient setting has had probably a fair amount of experience with that.
Well,
Um,
I recently had an experience. I'm Jewish, and
Me too.
um, oh, well, then you will relate to this to some degree. But I'm in the South. I'm in Little Rock, and I work at a children's hospital. But we also are the regional burn center for all of Arkansas, and so we take care of adults who are burned. And I had an adult that came in with a thermal injury from some explosion. Interesting. And I walk in the room and he has Nazi swastikas all over his arms and chest when I did the exam. And I I just continued my exam and just did what I could to take care of the patient. But internally, I was experiencing some conflict. I was experiencing agitation. I was experiencing, okay, my patient has Nazi swastikas, and, you know, the Nazis killed 6 million Jews during the Holocaust. Um, how do I feel about this? This feels yucky to me. Um, but I felt like in my role as a physician and doing the right thing for the patient, I just kept doing the right thing for the patient, and it all worked out. And actually, one thing that was nice about that experience is I had some of the people I work with know that I'm Jewish, some of the nurses and the physicians, and they came up to me and said, "I'm sorry that you're experiencing that," or "How do you feel about it?" And, they wanted to support me in a way that was actually kind of nice. But um, I also wrote an article recently in the last few years about my own unconscious bias being a white physician in the South, and some of the challenges that we have as someone who I consider myself privileged. And you said yourself, you're a white physician, and we take care of people of all different colors. And we have to recognize both our conscious and unconscious biases as we kind of go through this. And sometimes it can be really difficult. And so I'm actually really glad that you said something in that ceremony, because I think it happens. I've noticed in the South that it's interesting because I just moved from Oregon 6 years ago, and actually think it's interesting. On the coasts, we have a sense that racism and sexism is more prevalent in the South, in sort of the red states. And now that I've lived here, and I've lived in Virginia when I went there for college many years ago, and then for fellowship in Alabama, I think racism exists everywhere. I think
Oh yeah.
sexism exists everywhere. I think feelings of um, biases against people who are not heterosexual exists everywhere. And so um, I think sometimes it's a little bit more overt in some places than others, but I think it exists everywhere, and we just have to recognize it. And I think as physicians, we also have to be aware of it.
Yeah.
There has to be, like, in order for us to continue with this journey of improving and getting better, I think that we have to be aware of it. What do you think?
I mean, absolutely. I mean, in some sense, it's hard for me to say where is there more racism, because being white, I don't know if I'm the best person to even judge that. But I will say, even just like as a white person, I feel like there's a lot of racism up north, and um, I don't know. In some ways, it seems like it's every bit as bad as it is in the South, just perhaps in a different set of ways.
Hmm.
And I mean, one example is, like, my mom is a hospital chaplain, and so she works with a lot of priests. And often what will happen is, I think the majority of the priests that she works with at her hospital are Nigerian, and often patients will say, "I want to see a priest." And well, not often, but every so often they'll say, "I want to see a priest." And then the priest who comes to see them will be Nigerian. And then later the patient will say to somebody else, like, "Oh, well, I was hoping to see like a white priest." Or maybe they won't say it in so many words, but they'll sort of say, like, "Oh, that wasn't really, I thought they were going to be white," And I think that, I mean, I can't comment more broadly on that because it's not my experience. This is other people's experience. And you know, I only know this because my mom has mentioned it to me, you know, in the setting of like, this is a messed up thing that people sometimes will do. And I don't know. I think that sometimes people up north have this sort of self-congratulatory attitude of like, "Oh, well, we're not racist like those unenlightened, like, yahoos down south." And I think that's kind of a little bit uh deluded.
It's another bias.
Yeah, yeah,
It's another form
yeah,
of bias.
yeah,
So is your mom a chaplain in the Jewish tradition?
yeah, yeah. She's a rabbinic pastor, which is like it's like a rabbi, but specifically for like I guess like hospitals, like not like a synagogue, like a setting that's outside of a synagogue.
So was your mom ordained as a rabbi?
I guess technically, yeah. I mean, I think a rabbinic pastor is like a slightly different thing, but it's essentially, I mean, she went to rabbinical school for, I don't know, 5, 6 years.
Mm.
I went to her graduation in Colorado and got like the worst case of the flu I've ever had. So I don't remember much from it, but yeah.
That's
Um,
so interesting. So I'm curious with her chosen profession, how that has influenced you as a physician, like your relationship with your mom and her experiences, because her experiences must be really interesting as a rabbinic pastor and that lens of care. And I'm wondering how that, as the daughter of a mom of a rabbinic pastor, how that affects you as a physician.
Yeah, well, I will say when I was growing up, she was not yet doing this. When I was growing up, she was working in other areas. So she
Hmm.
went to rabbinical school after I was already out of the house. But I mean, I think it's fascinating. I mean, she'll tell me about the experiences that she had, and I definitely think I a lot of the skills that I've acquired, to the extent that I have them in terms of like how to talk to patients and how to discuss, really hard things, like in family meetings or, in any kind of goals of care conversations. I think I've learned from the things that she's told me about, like, "Oh, well, this patient was really upset by when this doctor said blah, blah, and blah," or "The doctor told them this, but what they really wanted to know was that." And I think one thing that she's sort of made clear to me that I think I've also sort of seen for myself now is that people will put on their best face for physicians. They'll kind of try to seem their best. They'll try to seem as well and as positive and as sort of, I guess, compliant as they can because they're aware that the doctor is sort of the authority figure and there's a desire to please you. And I get why people do that because they sense that you have very real power in that context. And I mean, for one thing, just as a physician and as a fellow human, that's something that we have to respect, that people are so that we have this power over people, and we have to take that really seriously. Um, but then in addition to that, the fact that what people are saying is not necessarily everything that's actually happening.
Hmm.
Like if someone is, and I mean, I know this also with, with my grandparents' generation and, older relatives that are kind of maybe more stoic, and they'll be like, "Well, I was having a lot of pain, but I didn't tell the doctor because I didn't want to bother them, or I didn't want to make them feel like they were doing a bad job. And it's like, well, no, I mean, I want to know if someone's in pain, but I think there are a lot of people who have that attitude that like, I don't want to be a bother. Um, and sometimes basically what you see is not what you get.
So what your training was both in pediatrics, because med peds is usually 4 years, and it's usually, at least here and in other places, it's 3 months you do peds, 3 months you do adults, and then you go back to peds, and which must be kind of an interesting juxtaposition, kind of going back and forth, and almost like first and third gear in a car. Uh, what what inspired you to focus mostly on adults after 4 years of training, of seeing both?
I think a lot of it was kind of situational more than anything. I mean, I can't say that I am always going to be only seeing adults. That's where I'm at right now. And I love CHA where I work. There aren't really a lot of opportunities at CHA to see pediatric inpatients. And I I don't really I like inpatient medicine more than outpatient medicine. Like clinic isn't really my thing. Mostly because I could never run on time. I always went way over my slot times, and I would then feel frantic and stressed, and would be there late doing my notes, which is a whole separate discussion about how we've arrived at this type of clinic setup. But like without getting into that, I'll say that like I think that I like seeing kids. I do miss that, but I would have to be able to figure out a way to do that in the inpatient world. And now with the increasing prevalence of like PHM fellowship and things like that, that's become somewhat more difficult.
Hmm.
Because I don't think at this point in my life I would want to do another 2 years of fellowship to be able to see pediatric inpatients. Um, and if that's something that is basically obligatory at this point, then I think that would be a challenge.
Yeah, I totally get it. So you wrote at the end of your essay something that really uh, moved me. And if I could read, I wonder what would happen if attendings talked to students about their families, their interests, their lives outside medicine. I wonder if they and we would start to feel less like members of a category and more like grown-ups. So do you right now, do you talk about your family? Do you talk, I mean, I find that one of the most interesting parts of this conversation is that your mom is a rabbinic pastor. So do you share much about your family and your story and your interests outside of medicine when you get to know the students?
I do. Yeah. I mean, I think I do. The challenge that I have is that I always wonder with the residents and students, I'm like, are they interested? Like, do they care? Like, I'll tell them some story about something that happened to me in residency where I'll be like, wow, that was so crazy that happened to me. And they'll kind of like look at me, and I can tell that they're like, okay, yeah, but I have to write like 8 notes right now. Like, you got to get out of here. And I'm like, okay, sorry. So like, I think the question I'm always asking myself is like, am I doing this for them, or am I doing it for myself? And I still haven't figured out the answer to that. Uh, I always want to. I mean, I feel like maybe everybody does, but I feel like I had so many experiences in residency where it's like, whoa, that was nuts. Like, and some of them are kind of, I would think would be interesting to other people, for other people to hear. But then I'm like, these residents themselves are also having crazy experiences, and they probably want to talk about those experiences with each other. And I remember the feeling when I was a resident, we'd be sitting in the workroom chatting about whatever, and then the attending would come in and we'd all be like, oh, like, gotta act like we're, being productive. I mean, you are being productive, but you don't want them to know that you were just talking about whatever gossip was going on.
Mm-hmm.
And I sometimes will see that now. I'll come in the room and they'll kind of go quiet. And, it's a learning point for me because, you know, I, I'll look at them and I'll be like, I'm not that much older than they are, but I'm in a role vis-a-vis them now that I can't be their friend and their confidant in the way that maybe when I was a senior resident, I could have been.
Sure.
And so, I want to respect that and not expect them to say more than they want to say.
Hmm. One of the things that I gained from reading your essay in JAMA was around the idea that, and I think this is true, that we as physicians and as physician educators, that it's important for us to connect with our trainees as human beings. And I think that's what you were kind of getting to, is that I'm not just what I'm going to be. I'm going into pediatrics. I'm not just this, but I'm a human being and I'm an adult and I have thoughts and feelings and experiences that are valid. And so one of the things that I was taught by one of my mentors here, his name is Kendall Stanford, is I work shifts. So do you. But when I show up for a shift, the first thing I do is I say hello to everyone. I intentionally walk around the ER. There are probably 20 nurses. I try to say hello to everyone. I get eye contact with them. I say, check in with the charge nurse. Hey, I'm here. Let me know how I can support you. And then the other thing that I do is when I work with a lot of people like you do, who are kind of coming in and leaving and coming in and out, and trainees, et cetera. And many times I don't know them. And so in the ED in particular, there's this culture of, okay, we got to do everything fast. I'm here. Let me present this patient to you. And they come to me and they start presenting and I have no idea who they are. So I'm like, okay, let's stop. What's your name? Where program are you coming from? Because I don't know if they're emergency medicine, family, pediatrics. And then what are you about? What are you doing? And I'll say, hey, have you heard about HUMED? I tell them about the podcast. They're like, oh, that's really cool. Let me follow it. And we have something on a human level that we're talking about. And do you feel like that's a valid learning point from your essay? It's really
Yeah.
about connecting with people on a human level and you're not just a specialty and you're not, what is that? Is that valid?
Yeah, I mean, I think it is. I think so. It's interesting because I worked with both the IM and the FM trainees, and the FM trainees, when they rounded.
Wait. We always talk about abbreviations. Internal medicine is, IM is internal medicine, FM is family medicine, for those of you
Yeah.
who are not physicians. So.
And the family medicine trainees have this tradition where at the start of rounds, they'll do like I forget what they call it, but they'll like one of them will have a question like, what is your favorite animal, or whatever, and then everyone will go around that day and say what it is, and you'll do that at the start of rounds. And I actually really like it. I mean, sometimes when the list is really long and then the question is really involved, like, when was the last time that you traveled, and where did you go, and how long were you there? And I'm like, okay, this is great, but like also we have like 16 patients to round on. But like even still, I think it's really, really nice that they do that, because I do think you gain insight into each other as people. And I think that's nice. And I think I would like to incorporate more things like that into rounds and into like what I do every day. I mean, I think the challenge is always, like you said, I mean,
Time.
time,
Yeah.
because, in a sense, for me, it doesn't even really matter that much because I'm a lot less pressed for time than the residents are. But I'm always mindful of time because for them, they're worried about getting their notes done and doing all the tasks that they have to do. And so I'm always like, well, how do I balance these things? And I don't think I have the answer yet, but I do think that it's really nice to have that moment where you can connect as people and not as like representatives of a hierarchy.
I totally get it. Well, this has been a fascinating discussion, and I'm incredibly honored and privileged to have you on. And congrats on getting your essay published in JAMA. That's no small feat.
Thank you. Thank you.
And congrats on your job. And I think that from our time spent together here and from your beautiful essay, I think that residents and learners are really lucky to have you as an attending.
Thank you.
And would love to have you on the show again and talk a little bit more about your journey. And thanks. It's been an honor and a pleasure to have you on HUMED.
Thank you so much. Thank you again for having me. This was lovely.
So for those of you who are listening, please hit subscribe on YouTube or Apple, Spotify, wherever you get your podcast information. And thank you for listening. This is Dr. David Spiro, and hope you all have a great rest of the day. Bye.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.